If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first you need to find the right team. Start your search with Indeed Sponsored Jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Every Who down in Who Newville liked the holidays a ton, but where to get great prices on gifts they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one Who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Hi, this is Dr. Raj, and this is the Med Prep to Go podcast, and I will be reviewing USMLE Step 1 High Yield questions. And today, well, it's going to be Neurology Day. I want to be reading 3 Step 1 Neuro questions that are definitely going to be appearing on your board exams. And to get more questions, go to our website, www.medprep2go.com. And let me remind everyone, this is a free audio and online question bank, which makes me really proud. And to learn more about me, Dr. Raj, check me out on my own podcast. One is called the Dr. Raj podcast, and number 2 is called the Beyond the Pearls podcast, based upon my best-selling book series with Elsevier. The title is Morning Report Beyond the Pearls, when we talk about Step 2 and Step 3 stuff. And then there's Case Reports Beyond the Pearls, which is going to be more basic science Step 1 stuff. And of course, it always makes me happy when you follow me on social media, Facebook, Twitter, Instagram, and I'm a little embarrassed about this. You even could find me on TikTok. Anyways, let's get to some questions. So first one is going to be a 48-year-old woman brought to the emergency department by her husband, who's concerned with her lack of speech. He reports that she has been acting and speaking normally last night, but this morning did not respond to his conversation with her. Past history is significant for hypertension. She's treated with hydrochlorothiazide. Vital signs are within normal limits. On exam, patient's able to follow commands, but unable to speak. A lesion in which of the following areas is the most likely cause of this patient's presenting symptoms? So this is a great kind of anatomy question. Do you know your neuroanatomy? Is it A, the arcuate fasciculus? Is it B, the cunis? C, the inferior frontal gyrus? D, the lingula gyrus? E, the superior temporal gyrus? And the right answer here is going to be C. This is the inferior frontal gyrus. This patient is presenting with intact comprehension but impaired speech fluency. These symptoms are characteristic of expressive aphasia, otherwise known as, oh, you guys are amazing, Broca aphasia. Broca aphasia is caused by damage due to a lesion in the inferior frontal gyrus. And you know this is high yield for the boards. So answer A, the arcuate fasciculus, is incorrect. A lesion in the arcuate fasciculus would result in conduction aphasia. Conduction aphasia is characterized by intact comprehension, intact speech fluency, but impaired repetition. Answer B, the cunis, is incorrect. The cunis is located in the occipital lobe, and a lesion there would result in a deficit with the inferior visual field. Answer D, the lingula gyrus, is incorrect. The lingula gyrus is in the occipital lobe, and a lesion there would result in deficits of the superior visual field. And last, choice E, the superior temporal gyrus is incorrect. A lesion in the superior temporal gyrus would result in Wernicke's aphasia, which is a receptive aphasia. Wernicke's aphasia is characterized by intact speech fluency, but impaired comprehension and impaired repetition. So what's the key teaching point here? Broca or expressive aphasia is caused by damage to the inferior frontal gyrus. Let's do another one. How about a 7-year-old boy is brought to the clinic by his parents who are concerned about his academic performance? They state that he is constantly in trouble for not paying attention in class and receiving numerous detentions for being, quote, off task, end quote. The patients say he is generally well behaved at home, although he does sometimes take a long time to complete his homework assignments because he is very meticulous and checks his work multiple times to make sure it's correct. The patient is well behaved in the exam room and sits in the corner coloring while the physician speaks with the parents. Occasionally, he stares into space for 8 to 10 seconds, making a slight smacking motion of the lips. Which of the following is most appropriate treatment for his underlying condition? So here are the choices. A is carbamazepine. B is clonidine. C, cognitive behavioral therapy, which always seems like the right answer when you take a board exam because it's not a drug. D, ethosuximide. Or E, Ritalin, methylphenidate. So the correct answer here is ethosuximide, which this is going to be 1,000% on your boards because you got to call what this disorder is. And this is going to be absence seizures, So this clinical vignette describes the classic findings of absence seizures, which generally last less than 10 seconds, involve staring spells, and can induce rhythmic movements such as lip smacking. Ethosuximide is definitely the memorized treatment of choice for absence seizures. Valproic acid is another common treatment, but it's generally going to be second line both clinically and on board exams. Choice A, carbamazepine, is incorrect. Carbamazepine is an antileptic, but is not successful in treating absence seizures. Clonidine is incorrect. Clonidine is an appropriate treatment for things such as Tourette syndrome. Although this patient is exhibiting some tic-like movements, he does not meet the criteria for Tourette's, and he also has no vocal tics. C, cognitive behavioral therapy, is incorrect. CBT is useful in treating OCD, obsessive compulsive disorder. However, the patient spending, quote, meticulous, end quote, time on his homework is not enough to suggest a diagnosis of OCD. And I'm sure we all could spend a little more time on our homework, or at least, my kids can. And I didn't mean that, kids. I love you. Choice E, Ritalin, is incorrect. So methylphenidate would be appropriate for, attention deficit hyperactivity disorder. Absence seizures and ADHD are often confused. However, this patient does not show any signs of hyperactivity and no other signs of inattention other than the staring spells. Additionally, he is only experiencing difficulties in one setting, school, and would need to be experiencing problems in at least 2 settings to be diagnosed with ADHD. And let me just say on a side note, when we talk about these stimulants, they do have a multitude of side effects. And of course, you want to make the correct diagnosis. And that when you're on stimulants, whether it's Ritalin, whether it's Adderall, that they could actually make seizures worse or induce seizures. When you're on these medications, these stimulants, you always want to check body weight. You can lose a lot of weight from there. Maybe more so in adults than in kids. You worry about high blood pressure, about tachyarrhythmias in these patients over here. And of course, whether you're adult or pediatric, being on these medications can change your mood. And, we do give stimulants for ADHD, ADD, and they even use this in children who have autism combined with ADHD, which is really hard. These kids can get very angry and not express what they're feeling. So these are not benign medications. Just on the side note, maybe you're wondering about drugs like modafinil or armodafinil. That we use as stimulants in adults. We don't use those in kids less than 18 years of age. For one reason, it may induce a Stevens-Johnson syndrome, which is really a horrible, horrible, life-threatening, skin manifestation of the medication itself. So you want to be careful in general of using modafinil, armodafinil. People with sulfa allergies, just want to mention that. But regardless of all the beautiful pearls I just gave you, methylphenidate is the wrong answer here. What's the key learning point? Ethosuximide is first-line treatment for absence seizures.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at MichelobUltra.com/courtside. Michelob Ultra courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at MichelobUltra.com/courtside for free entry deadlines, prizes, and details.
And let's round off this with one last question. A 63-year-old woman. Her husband presents to the physician's office due to concern about behavioral changes over the past 4 weeks. The patient's husband states that she has been having episodes where she will have a blank stare for 5 minutes and pick at her shirt. Afterwards, she appears confused for up to an hour and does not remember the episode. The woman adds that she often experiences an unpleasant smell before an episode. Which of the following is the most likely location of abnormal electrical activity causing this patient's symptoms? All right. Kind of sounds like she's having a seizure, right? So is it A, frontal lobe, B, occipital lobe, C, parietal lobe, D, temporal lobe, or E, the thalamus? And the right answer here is going to be D, temporal lobe. So these are going to be focal seizures, and they can be categorized as simple or complex. Simple focal seizures occur when the patient is aware throughout the seizure. Focal seizures typically arise from the medial temporal lobe. Patients may experience motor, sensory, or autonomic symptoms. These include vocalizations, muscle movement, olfactory or auditory sensations, and hallucinations. So what is going to be the learning point over here? That focal seizures typically arise from the medial temporal lobe. Patients may experience automatisms or sensory changes. Simple focal seizures occur when the patient is aware of the seizure. And on a side note, when I think about temporal lobe, I mean, one of the infections I worry about when someone presents with seizures and you suspect some kind of meningitis, you definitely worry about herpes simplex. And, when you think of HSV, you always think about involving the temporal lobes. They are often associated with seizures. I know buzzwords for the boards when you do a lumbar puncture, as you should. Not only should you send the HSV PCR, but, it could be, you can see some RBCs in there, red blood cells. So these were some high yield questions for the boards, including some really important neuroanatomy. And if you folks enjoyed this, go check out the website. And once again, I'm going to tell you, it's medprep2go.com.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.